All right, we are live here. I got my friend Pete Meitzner with us. He's the chairman of the county commission. As we've communicated multiple times, the city is kind of in the passenger seat when it comes to local authority on taking action for the coronavirus. The driver's seat is over across the street with our friends on the commission. Pete Meitzner is joining us to help us answer some questions. Please feel free to start typing in your questions as we get started. So first, welcome, Chairman. It's good
Absolutely.
to have you.
Mayor, I'm glad to be here. We've forged a relationship these last 6 weeks that we didn't know we were going to have to challenge this stuff, but I'm glad. Thanks for inviting me.
Of course, and I really appreciate all your help with this. We're an interesting kind of learning curve, I guess, being mayor, is that a lot of people, I think, look to the mayor as to why you're doing this or that. And it's really a lot easier for me to say, no, you should just go talk to Pete. You should blame Pete because here in Kansas, our county commissioners are the ones in charge of healthcare crisis policy, and not like over in Missouri where the mayors are in charge. So yeah, I think that one of the good parts about you being accessible is that I can push all those questions over to you, and you've been able to address them.
Yeah, as we serve as the Board of Health, when I first got in to the commission, I was asking, what is this Board of Health really? And it was really more about all we were doing was approving many health grants, federal, state, and just kind of we approve it, gets to the right health department, aging, all those things. And so
used to be an easy job.
Yeah, I never really thought that this is really the extreme end role of Board of Public Health. So it's been quite challenging.
Oh, it has, but I think that given the severity of this crisis and the fact that we haven't really faced anything like this in over 100 years, Wichita, we're in Sedgwick County, we're in a lot better position than I think a lot of our comparable counties, and that is a big part because of the collaboration between the county and the city, and also the governor's office, and to some extent even communicating up to the federal delegation as they've gone through these stimulus packages. So we're not out of the woods yet. We still have we still have the summer, we still have the reopening, and that's one of our economy and our state on a tiered approach. And that's one of the reasons why we're live today is, hoping that people who are watching this can go ahead and type in your questions and we can get to some of those. So after the governor's announcement last week, we have begun discussions on opening things back up in City Hall. As for those of you who follow city government, probably recall, we are on a skeleton crew right now. We have closed down a municipal court. We have made it so we don't have any large gatherings. Here in City Hall, we have switched our public meetings to be an online format where people can interact through the online structure. And we have to now think about the safest way to start reopening not just City Hall, but also some of our other programs I think people expect out of the city over the summer. We are balancing public safety, with providing that service. So those talks are ongoing, and as they start to formulate into our plan, I'm looking forward to communicate that plan with the public and getting people's feedback to make sure that we're meeting their expectations as well. So our top priority is public safety, and we'll continue to update you on what the reopening looks like. And again, we have to continue to analyze the governor's announcement, as it was a very complex tiered level plan that she presented for us. So, with that, Chairman, what were your thoughts on the governor's plan to reopen the state?
Well, I think we've all we've heard a lot. I would guess overall it's not perfect, but she did a really nice job of taking this first step, especially restaurants and most all retail business can now be open to an extent. And I think she did a nice job with the 10-person gathering to start with. There was a lot of confusion about that originally. Thursday night, she was done at 7, and about 7:02, I'm sure your phone and all of our emails and phones were ringing quite a lot Thursday night and even Friday morning before we met at 10 o'clock to try to explain. I think the biggest two confusions was the 10-person gathering a lot of people thought, well, that didn't do any good. It's not any better than it was. Well, that's wrong. I mean, churches, restaurants, everything. And then the other one was, well, how do I know if I can be open or not? Well, if you were not on that list, if your business or your industry or your service was not on that original list of eight or nine industries, then you were allowed to be open. And so that once that kind of calmed down, then I think it allowed everybody to really start focusing. Okay, well, I've got a few days. When do I want to open? Get employees, make sure we're clean and ready to serve. So there was a kind of a rough Thursday night and Friday morning, but the weekend was calmer than I'd expected. And today has been there's been some questions, but it is 3:00 Monday afternoon of day one, and so I was saying before, the streets are a little busier and traffic's a little busier, so we'll see.
Very good, yeah. And one of the things that we want to make sure as we start to abide by the governor's order is also making sure that we don't have any unintended consequences. If something starts to show to be moving too fast too soon, then that feedback is something the county would want to have so that they can make any adjustments as needed. Right.
I think so, and the governor and we all are watching those three areas: hospitals, death rate, and then and the rate of positive tests versus we're testing a lot more now. So the percentage of positive tests versus testing that we did 100 and as of this afternoon, the Sedgwick County, we did 139 tests drive-by, which was really good. We've been talking about testing and limited, but we have a lot of test kits now, and so we were hoping to be able to test over 100 a day. Did 139 today, so nice. We're making progress on that.
So yeah, let's talk about that for a moment, because this is something as mayor I get a lot of feedback on, where people talk about how, well, your confirmed cases are going up, so why are we thinking about reopening, and add to this if you can, is one of the reasons why the confirmed cases are going up is because when we have more tests, we're able to test more people right. whose symptoms might be less symptoms than what we were originally working off of when we had less tests, right? Like, so in the beginning, we had a finite number of tests, and to get a test, you had to reach this criteria. Right. If you're almost towards that criteria, we would actually just have you self-isolate and treat any symptoms. So now we're having more tests. That's going to, you test more people, likely bump up the number of confirmed cases, but that doesn't necessarily mean that we have a higher level of spread, does it?
Correct. And Dr. Mims was at our Friday meeting. He was really stressed that. He said, we want more tests and we want more cases because, well, maybe I shouldn't say it quite that way. we want to know about more cases.
Right, more data.
Because, since we've started this, we've had 436 cases, positive cases in Sedgwick County, and 237, so that's over half have recovered. And it used to be right at half, used to be a little under half, and now we're showing more people have recovered than over half have recovered. And so very few hospitalizations, mainly isolation at home. So that's what we want to keep doing is, and then we can start looking at maybe zip code data and really start drill down. I don't think we're going to be at a place where we can just do anybody who wants to get tested can get tested yet. Mm-hmm. We don't have that kind of supply. But if you do have, you call 211, which United of the Plains has been fantastic, the 211 number. They do a quick question with you, and then they determine, hey, yeah, you need to, why don't you come in and get tested. It used to be you had to have all three, like you said. Now it's just two, and I think they're a little hedging. Even if you have one symptom, they might ask you to come in. So,
and I just want to make that, your last point there is one I've received a lot of questions on. So if you are someone who believes you might have been exposed to COVID or you might have the symptoms, we have other things going on in our community too, right? Like where you can have the flu, you can have some other ailment, but we hear a lot about COVID. So if you're one of those people who are feeling sick and you want to get tested, the first thing to do is to call our friends over the United Way 211, and as you said, they will go through a list of symptoms. Do you have this, or this? And if they if the United Way determines that, okay, yeah, you qualify to go get a test, then a test will be available for them over at the county?
Yeah, at no charge.
No charge.
That drive up over there on West Central should have the address, but it's just west of the river. And then actually we have staff available at the county building on 9th Street in the Canal Route. So there's some testing can go on there too if people are close to there and have transportation problems. So they've been arranging that as well. So.
Excellent. So another thing I'm just going to point out, and then we'll take some questions. If you are someone who has questions about the governor's order, just a quick civics facts, I guess. We cannot make changes to the governor's order. Some of those changes could be made at the county level as far as tightening the order, but as far as making any type of exemptions, all that has to come from the state level. At the city level and then the county level, we can't go outside the bubble that the state has created for us. So if you are someone who has questions or feedback for the governor, please don't call 911. We've had reports that people have been calling 911. We want to keep those lines as free and open as possible. Obviously, for people who are having other emergencies, want to make sure that 911 is a line that stays clear. So instead, I want to just make sure that you all have the number to the governor's office, and that is 785-368-8500. So one more time, 785-368-8500. That is the governor's office. They are the only ones who can make any type of exceptions or changes to the statewide system for tiering, the layer system to get us back to some level of normalcy. So with that, let's go ahead and take some questions. Megan, do we have any?
We have quite a few.
Okay.
We do have a hard stop around 3:25, so we'll get to as many as we can. We're getting a lot of questions about city and county facilities. Specifically, when do we plan them to open to the public? I know some of those plans are ongoing, but can you speak to that?
Well, I know the county, we have some offices open. The tag office is open. Anything that can go on in the main courthouse by appointment is open. The judges, we've got a lot of floors that are courts, and the judges are getting together with the Supreme Court judges and trying to determine the best. They've been having some courts cases, so I know this week, I don't think that the county is going to be open business as usual, but they're also doing things like I saw here at the city office where you're going to have, it's going to look a little different when you walk in. It's kind of like after 911, all of a sudden you were going through various things and travel wasn't as easy after 911. I think public access to these buildings will be a little more orderly and secure. But not this week. I think next week we will be more. So we can go ahead and the city.
And on the city level, the first thing we're taking into consideration is people's safety. We need to balance the safety with reopening the economy, because you really can't have one without the other. Public safety and economic growth go hand in hand. I've been getting questions about dog parks, about different types of activities over at the library. When are we going to have court opened again? And just kind of to complete my thought early on in this, when we started, we're starting to have those conversations to develop a plan to reopen up City Hall and our functions. Everything that we're considering as far as variables has to do with public safety, where we can have certain parks open where people can go in and jog, they can go walk, but dog parks, we're a little worried about some of the common touch areas, right? So that is why some places are open, some places aren't. So that's something that we have staff working on. We want to make sure that we take the safety of our citizens into account before opening up and possibly putting anybody at risk. Megan?
Perfect. This one's for Pete. What has been your experience acting as the medical board of health during this time? Has that been a good experience? Do you feel like it's been impactful for the public?
It's been quite an experience. it's really kind of hard because we're elected officials and not one of us are medical professionals. I feel lucky that at my age and some relationships, I have some tremendous medical doctor friends that have been friends way before I was elected and will be after. So I get to lean on them, and especially as a couple of friends that are in the infectious disease area. So, but boy, it's been really hard. I thought learning about, when I was at the city, I thought learning how complicated water and sewer system was something that wasn't quite prepared for to learn. But this one has been harder than that. So I think when this is all done, I think it's going to be worth us looking at what would be a board of health that would be, because as a government, I hate to be in the way of maybe what. And so we're really just going with these decisions based on the best we can from those expert advisors. But I think after this is over, I don't have a personal desire to be the chairman of a board of health without some good stuff, reasoning behind it. So, thank you.
Perfect. For our most vulnerable citizens, is there advice on going forward? Should they continue to enact social distancing and stay home whenever possible?
Yeah, I'll take this one. So one of the important, and Pete, jump in here if I get anything wrong, of course. One of the important things moving forward is knowing that this is still in our community. When we are reopening, flattening the curve was to make sure we didn't have a rush on the hospitals. And as we reopen, we want to make sure that we do it slowly. So if we start to see an uptick in hospital usage, we can start slowing things down. So I want to make it clear that this isn't like a storm that hit us and now it's past us and it's okay to come outside again. It's still with us. If you're a member of that vulnerable population or you live with someone who is in that vulnerable population, let's say you have a compromised immune system, or you are someone who's older, really, we still want to practice social distancing. You still want to go out only when needed and kind of just buy yourself some time until we have better remedies, right? Until there's better treatment for this, which I think medical researchers are working around the clock to develop that throughout the world. And then also, if we get a vaccine, that will probably be about a year from now. Those take quite a while to go through testing, but we are seeing some progress on treatments. So we got to make sure that we try to keep those who are most vulnerable as free from this as possible, because it's still just as dangerous as it was a month ago. And hopefully we'll start having some medical breakthroughs and be able to treat this better.
Yeah, I just two things. We're kind of I would encourage those that if you feel vulnerable, to still, you can stay at home. You have to do what you're comfortable with. If you're a little afraid to get out, then don't get out. We formerly were quite a social city where you go to a store and you see your friends and you stop and talk, church, school gatherings. But that has changed. We've all learned that now let's just pass and through the aisle and nod and move on. So I think that's one thing. But the second part is that the mayor and I are on calls with the hospitals every Monday, and they have been really the last 2 weeks. They've been really saying that if you feel bad, so if you're vulnerable and you're just saying, I got some heart conditions or anything like that, they want you to call your doctor or to get into the emergency room, because sometimes they've had cases where it was too late. They couldn't. Right. And these are non-COVID related illnesses that respiratory, whatever. So don't feel like you need to stay home. Don't be afraid of the hospital. These people this is what they're made to do. They're ready to do this. So if you're feeling vulnerable, either feel free to stay at home, but if you're sick, please feel free to go to the hospital.
Yeah, and just on top of that, the whole trying to make sure that we limit the rush into the hospital is also to avoid what's called preventable deaths, right? Where if you are someone who has a heart condition and all the beds are taken up by COVID patients, you might not be able to get seen in time. That's not what's happening right now in Wichita. We did a really good job of flattening that curve. So if you are someone who, as the commissioner said, are having some symptoms of a underlying illness, make sure you go to the hospital. You will be seen, and we want to make sure that people can still get the treatments that they need. Megan, we might have time for one more.
I think we have time for just about two more.
Oh, awesome.
This one is an interesting hypothetical. So if we are seeing an uptick in cases, is it possible that we might enact more restrictions?
So that would be over in the county commission lane.
Right. I would say the short answer is yes, restrictions could happen. I think the governor, my conversations with their office is there was no intent to improve that 2 weeks of date from today through 2 weeks till the 18th. I would be totally surprised if she was ever going to try to do something before that. So, and in that same threshold, she's saying that if we're hoping to see flat and consistent numbers or minor increases to where we feel like we're controlling, then we move to the next step. If something happens really bad, then she can come out, or if it's county specific, such as what's going on maybe in Ford County out in west, I mean, they can make their own restrictions further. So we'll be watching it locally and statewide.
Perfect. I think we have time for one more. If a business is not in compliance, for example, during phase one, gyms, salons aren't allowed to operate. If they're not in compliance, how is that being enforced?
That's a good question. I think enforcement also falls to the county.
Well, we would like to ask the city to enforce, please. So.
You want me to go out there?
No, not to make light of it, but it is only 2 weeks. We know that there's some youth activities going on. Kids would normally be in school right now still at this date. But I know there's some baseball stuff they're kind of using a field, practicing, playing catch. So there's some, and so there's the enforcement is really going to be more educational and saying what we really want to do is we want to avoid these mass gatherings. We don't want to have these large gatherings for these 2 weeks. So isolated cases, if somebody's providing some service that's not on the list, I don't see a major enforcement going on. But violation, I guess it is a state order, so it could have you could get an infraction and it ends up being a class whatever misdemeanor that comes with a fine if it got to be that way. But I would think that would be only if somebody was in broad defiance of the order after somebody talked to them.
So exactly, and I just want to jump in here where we've had throughout the last few months. We've had cases where people were in defiance, where just business open up, bring a bunch of people into one room, and then it was reported back to us with video that this was going on, and that they were just in defiance. We don't care about the order. We don't, you can't do anything to us. And we've been able to send our officers out there just with the only tool they had was education to say, like, this is why this is a bad idea. And to be frank, it's worked. We've seen the majority of Wichitans, and this isn't unexpected, of course, where if you provide them with the right information and the facts, they make the right decision. So, early on and even now, usually education is what's working. Just telling people pretty much the main part is that it's not really about the individual. It's not really about myself or, let's say, the commissioner, where if we choose to go out and to socialize with people and get break these that 6 foot rule, it's not just that we could get sick. It's not just, hey, this is my choice. I have the right to go get myself sick if I want. The real problem is that I could be sick for up to 14 days before I get any symptoms at all, and that's even if I get symptoms. So during that time frame, this could spread to people who I don't know. It could spread because I cough and then I touch a doorknob, and then someone behind me comes and uses that door. It's a highly contagious virus that we want to make sure that not only the people who are sick get treated, but don't spread that onward. So although you're going to see stuff on the internet about how only a percentage of people actually will die from this, and that there's a large percentage of people who are younger and healthy who can fight it off, it's not that we're worried about those people becoming sick. We're worried that those people might transfer this to the population who is the most vulnerable. And that's where we've seen other cities go really really kind of downhill. We see the majority of deaths are coming from not grandma going out and catching this, but someone going to visit grandma who had it and didn't know it. So moving forward, we want to make sure that you might be okay with, heck, I've been cooped up in the house. I don't care if I get sick. I need to go out and go do some stuff. It's not that we're trying to prevent you to do stuff like that. It's that we want to educate you to know that if you go and you catch this, you might be spreading it to others. So it's not just the individual that we're thinking about, it's our neighbors as well. And Megan, I don't know if we have time for more questions or...
Can I just mention one thing?
Of course.
For the audience? It looks like a lot of questions are getting answered, but the governor's got a website. It's covid.ks.gov, covid.ks.gov. And in there you can see her order, you can see the plans, the next phases, but also there's a reference tool in there. If you're in any industry, what the guidelines would be for that industry if you're going to open up. It doesn't mean that you have to follow them, but that's your guidelines as a business or a service provider. And so that's an area, or you can actually go to sedgwickcounty.org, and on our homepage, we reference links right to those same things that I just described. So you've got two accesses. It's really good. The governor's got a FAQ, frequent asked questions part. So there's a lot of information you can get there before deciding to make a lot of phone calls. So thank you for letting me put that plug in.
Of course, and I know we're wrapping up. I do just want to point out that the governor and her staff have actually been in conversations with industry leaders within these different industries to ask about what their recommendations are for reopening. So those people are in a room. It's not just being done by the governor's staff. It's actually being done by different boards that regulate different different industries as well, which is why these are different than others, and it might actually have some what we might think is contradictions. Well, why is this open and this isn't open? Is this more essential than that? The reality is it's not so much about what's essential right now, it's about what's safe. And when you bring in kind of these experts into the room, then they can help create policy that's going to keep people most safe. Last thing I want to just close on is the fact that if you are someone who wants to know when our library is going to be open, when City Hall going to be open, when our the dog park's going to be open. We have on our city website, we will have our plans updated and posted as they evolve. And that website is wichita.gov/coronavirus. So wichita.gov/coronavirus. That's where our plans will be unfolding. Of course, if you got any questions for me, feel free to reach out to me on Facebook, on Twitter, shoot me an email. I'd be more than happy to interact with people, and also make sure you reach out to the county commission. And if you have any questions for the county commission, you reach out to me. I'll make sure to pass them along. Thank you all for joining us.
Thank you.